I have lines under my eyes. What are possible options to get rid of them? I am 28 years old. I have a lot of fine lines under my eyes. When I smile, they are even worse. I got 1 unit of Botox on each side, but that didn't really help. At the clinic I go to, the nurse says nothing will really help to prevent these lines, but I want to explore my options. Please suggest an option, and can Pelleve be one of my options? I added 3 pictures. One is when I smile. You can see a lot of lines. The other 2 without a smile. Thanks in advance for response to all doctors.
Thank you for your question. You've submitted several photos and you describe in your question that you're 28 years old, you have dark skin, and you have some fine lines under your eyes, and you've gone to a doctor and you had a Botox injection after which you felt didn't make that much of a difference. And you're asking, is there any value in using Pelleve? Well, I can certainly assist you with this. I'm a board-certified cosmetic surgeon and fellowship-trained cosmetic oculofacial plastic surgeon practicing in Manhattan and Long Island for over 20 years. And the treatment of the eyelid area and eye rejuvenation has been a major part of my practice, and with a focus in particular on ethnic eyelid rejuvenation. Many years ago, I actually wrote one of the first articles about the ethnic considerations with eyelid surgery, and I get a lot of patients from all over the world with a variety of backgrounds who are looking for solutions to improve the appearance of their eyes. So when you ask a question like this, I'll describe what I do in my practice. When I look at someone like yourself, I think first, are these lines natural lines that you expect, or are these lines that are a change that are related to aging, environmental or sun exposure, and other factors? Now, in general, those fine lines that are directly below the eyelid margin are very difficult to treat regardless of the cause. But when you want to try to improve those lines, we have to ask ourselves the simple question: how much of an improvement are we aiming to achieve? How much of an improvement can we achieve? There's no question in my practice where, for people who are not good candidates for lasers, and that basically covers anyone with darker skin who is at risk of pigmentation changes from laser, Pelleve, which is a radiofrequency technology to help stimulate collagen and effectively tighten the skin up to a certain point, certainly is an option. But when we're talking about someone in your age with the relative fine lines under the eyes, I would probably not recommend Pelleve. I think that heating up the skin has a certain limit, and currently I feel that many of the thermal energy devices are being overly aggressive and are overheating a lot of people's skin, and we're starting to see a lot of this. I've been saying this for years, that there's a certain amount of stress you can impose upon the skin, and the skin will respond by generating collagen. But once you exceed a certain amount of stress, the skin cannot respond and it breaks down. And so a lot of people are coming into my practice after getting thermal device, and it's not just a single one, but maybe multiple devices, because the scenario is such where the doctor uses one thermal device, doesn't work out so well. They use another thermal device, doesn't work out so well. The patient goes to another doctor who says, I've got a thermal device, and then it doesn't work out well. By the time they're done, their skin is really broken down. Which brings me to how we help these patients. We actually use something called platelet-rich plasma, where we're using your own body's natural ability to heal, using the critical growth factors in cells used in wound healing to stimulate collagen and to stimulate the skin quality. And we've had tremendous success in the treatment of dark under eye circles, and for people who have hollows and who want to improve fine lines, we use platelet-rich plasma for acne scars. So certainly that is something that I might consider when I would see you in consultation. But again, it's a matter of what is your goal. If your goal is to try to see some improvement, then I would consider platelet-rich plasma. But most likely, I would probably talk you out of doing anything, because at 28 years old, with dark skin and relatively few fine lines under the eyes, I don't think we're going to be able to make enough of an impact to justify the cost and time needed to do these therapies, where we might be able to document photographically an improvement, but it might not be enough for you. I think it's very, very important, which is why I spend a lot of time with every patient, particularly in their first consultation, with understanding the problem and the desired objective and what is defined as success. I've turned away a good number of patients who I felt where their expectations did not in any way come close to what I could possibly achieve, regardless of the modalities. And since I really have no limits, I do both non-surgical, minimally invasive procedures to advanced cosmetic surgical procedures, particularly around the eyes. There's no real limit for my ability to do something that's available. But at the same time, we can't make everybody perfect. And I think that we have to be careful about that. So with that being said, you may want to rethink this and just meet with other doctors and learn about your options, but always be clear about what you expect. And if you can't get that type of commitment from the doctor that there will be the level of improvement that you would like, then it's better not to do anything. So I hope that was helpful. I wish you the best of luck, and thank you for your question.